Webb. I see Commissioner Toyoka, Commissioner Thompson. I don't see Commissioner Webb. We'll go ahead though and get started. We've got a lot of things that we want to get through tonight. The work session is an opportunity for board members to discuss issues informally with staff and invited guests. The board encourages members of the public to attend work sessions and listen to the discussion, but there's generally no opportunity for public comment. Members of the public wishing to address the board are welcome to do so during the board's regularly scheduled meetings. And we will have one at 6 o'clock. We'll start with board communications. Commissioner Thompson. Thompson, can you hear me? I think Commissioner Thompson is frozen. Let's go to Commissioner Toyoka.
Oh, good evening, everyone. I will reserve any update for the regular meeting. Just do it once. Thank you.
Thank you, Commissioner Toyoka. Okay, we've got Commissioner Bangs back. Let's go back to Commissioner.
We found our shin guards. No. I will save my comments for our regular meeting, and it's good to see everyone. And I'm sorry I left my mic on for that adventure.
No problem. Commissioner Thompson.
Thank you. I'm here. Sometimes I get nervous and press twice, Commissioner Toyoka. Thanks for the reminder.
Thank you, Commissioner Thompson. Do we have Commissioner Webb? And I'll go ahead and reserve my comments for the regular meeting as well. Let's go right into the formal agenda. Have we had an opportunity to review the formal agenda this evening? Any questions, comments? Okay. Let's move on to the topics on the agenda for the work session. That's the public health update. And we have our interim public health director, Margot Lalich, with us. And I'll go ahead and turn it over to Margot.
Good evening, commissioners. I hope you're all well. I have a little bit of an update or more continuation of what we've been doing. There's certainly a lot of activity around the pandemic right now. Perspectives, opinions, fact versus some storytelling. And so I'm going to stay focused on the facts, and I'm not going to cite a lot of specific numbers because that's changing so rapidly. What I will tell you is that we do have an increasing number, probably more than 20 outbreaks. Again, it's not surprising. We are completely open and we're managing the mask mandates and implementing them. But as we know, there's also resistance, and behavior change takes time. So we navigate that thoughtfully with consideration for the different perspectives that we live and work with. We are focusing, as always, on the most vulnerable populations right now. Statewide, we're in what's called a surge protocol. And so that dictates how much we get into the weeds without losing sight of what's most important and what puts certain individuals at greatest risk. Where we are seeing expanding outbreaks in congregate living situations, particularly with the elderly, we are working with our entire state team, from infection control practitioners to licensing inspectors. And actually, I just had a meeting this afternoon with them. There were 6 of us on the call. And what's really, I think, heartwarming about this is the recognition that everyone is doing the best that they know how to do with the resources they have. Everyone's very well intentioned. Everyone wants to learn. Everyone wants to do the right thing. And it gives us pause to reflect on, you know, what is specifically related to individual policies and protocols and procedures of a workplace, and what is a result of how we systematically respond to perhaps the levels of care in which we provide certain populations. So we're working very closely together, long days, making sure that all of those who are affected by more than that isolated case have access to resources. So those EOC requests are increasing. We have plenty of supplies at the EOC. We continue to schedule vaccination events to make sure that we're reaching all populations, whether it's fish processing, again, those congregate living situations, schools, and I'll talk a little bit more about that. We continue to offer Q&A sessions. I just had 2 of those conversations yesterday with particular work sites or organizations in which they're trying to navigate this, but there's still a lot of questions out there, and making that offer that public health is always available to meet with your board at a time that's convenient to answer the questions that you have. And if we don't have the answers, because we don't have all the answers, and as you know, guidance can be changing rather frequently these days, we will get those answers. We have our weekly meetings with the superintendents. We just had that meeting today, and I'm very pleased to report that we have a dedicated individual with a tremendous amount of expertise in public health in this community, as well as school-based health, who will serve as a liaison between public health and our superintendents and school nurses, is participating in all those statewide local meetings to make sure that we have redundant resources to support the schools. And I really, every school district has its unique personality, its unique community, and yet what I will say is our superintendents, our school nurses are doing really good planning in preparation for this school year, and I want to commend them. In terms of testing, you know, we have about a 10% positivity rate. We just had another testing event today. I think we tested 50, 60 people, had a few walk-ins, but our drive-through testing events continue to go well. I'm very pleased to announce that we will have a permanent testing site for the duration of this pandemic out at Camp Rylea. They are just coming through as a partner in every way, so we will actually be we met this last week to look at the flow of cars, where it's going to be located. They're working with us in terms of signage, any infrastructure supports that we need. And again, this is a joint operation with Providence Seaside Hospital and Columbia Memorial Hospital. So there'll be shared staffing as well as our dedicated volunteers. Again, we thought we were going to be out of PCR testing supplies, and then we just had some more supplies that came through. So again, we have to be flexible and patient as we continue to adapt and navigate the supplies that will allow us to do the most appropriate testing. We're seeing we are prioritizing students returning to college, right? Many colleges are asking for tests before students come back. We want our students to return to college, and we want them to have the information, the health information they need to do so, so there are no delays. We also, our PIC is functioning very well at Camp Rylea as well, and I just want to commend our IT department, Camp Rylea, and emergency management. You know, we learn when we set up an operation like this, and that prepares us better for future emergencies that could take place. But that's working well. It's staffed with six people continuously, and we are getting enough of a call volume that we're implementing a voicemail system as well, so we can make sure that no call is missed. So I think that's going well. And I just received news this afternoon that it looks like Camp Rylea, it will also be willing to host a permanent vaccination site for us as well. So I'm very pleased about that. So we will really have centralized operations, and the vaccine task force is now increasing its meeting days to twice a week, and of course, when it needs to be 5 days a week, it will. We have our dedicated team coming together, and we're already in the weeds looking at our staffing. I've already communicated with our CBOs and transportation to make sure that that's going to be in place. And again, you know, just all the logistics of setting up clinical operations again. And our volunteer coordinator is doing what she does so well to make sure that we're planning ahead, and we're well staffed with volunteers. So I'm pleased about that. I'm trying to think what else. I told you these are our 3 focus areas, so I'm trying to stay within the context of each of those. I am getting, calls and some messages. We are getting emails, and then there's a variety of questions and concerns being articulated, whether it's related to Hood to Coast, the mandates that are coming from the governor, to just clarification around the continuing changing recommendations. And I think 2 of the, well, one for sure today is we thought it was going to be 8 months before we could do booster doses. Now it looks like it's going to be 6 months. And while that's good news, it really does change the population that we're going to be able to vaccinate when that time comes. Those who are immunocompromised, we continue to provide clarification. We just sent out a broadcast fax to our pharmacists today. And, we are vaccinating that population to have access to that care. So I'll stop there. I'm at 5:11, and so I'm happy to answer any questions, and also want to be respectful of your agenda and the time that you have tonight.
This is extremely important, so I think we need to take our time. Commissioner Webb, I think you had your hand up first.
Yes, thank you. Thank you very much, Margot. This was nice and complete. Who is the person who is going to be the liaison with the school districts?
Her name is Mary Lynn McConnell. She was very, very well-respected, iconic public health nurse in Clatsop County for about 30 years. And then she also, when public health did everything from home health, public health, we were the school nurses, all aspects of kind of community-based outreach. And then she also was the school nurse after retirement out in Napa, and she has stayed connected to the schools all these years. She's also been a dedicated vaccinator during this whole campaign. So she is volunteering her time. This is her heart and soul work. She cares deeply about the community. Just got the cell phone for her today, and she is already participating in all of our meetings, whether they're the state meetings with our Conference of Local Health Officials related to schools, or our superintendent's meeting. So this is good.
Thank you. That's good job. That's always one of the things I'm most concerned about, and the fact that instead of you having to spend that time, I'm so pleased. Thank you so much for that.
You're welcome. We're all pleased. We're still being involved, but having that liaison is just going to be valuable, especially with someone with that level of expertise.
Commissioner Banks.
I had a couple questions. I think the first question I had is there's so much information out there, but getting down to the nitty-gritty on the Delta variant, do we have any information on how different it is for the 0 to 18 age group?
I can't cite you that specifically. Generally, what we're seeing, I can get you that information, but not at this moment. I actually haven't had much chance today to look at any of the updated data. I apologize for that. What I do know from our meeting yesterday with Dr. Paul Cieslak, Dr. Seidlinger, and our county colleagues is that we are definitely seeing the 0 to 18 becoming more ill, increased hospitalizations. As I shared with you before, we have the pediatric dashboard. What I also learned yesterday is the Oregon State Public Health Lab is adapting to this evolving situation. And so how they're going to be genotyping the variants as they come along is beyond my depth of understanding, other than what I do know. I know some about virology, but this is getting into the nitty-gritty analytics. And so they are making a shift, and I think part of that is the ability to dissect much more what we're seeing, what we're coming through, and in the ability to be more anticipatory for what's coming. So, and again, I think I've said this before, you know, when we get the variant reports or the breakthrough cases, which I actually think they're going to move away from that language for good reason. You know, it'll say like there's 26, you know, confirmed, you know, cases, positive cases that are the Delta variant. That's not, there's far more cases than that, because what we know is that it's so highly transmissible between the vaccinated and unvaccinated. They get that number through random sampling, right? And there's sequencing, and then there are labs that participate in providing those samples, including from our county. So that's how we get that number, but there's many more cases than that.
Commissioner Banks, you had another question?
Well, technically I have two more, but I'm okay waiting my turn. In regards to the booster vaccine, is there any information out there stating, or any thought processes, I guess, stating, so say you had the Moderna vaccine for your first 2 shots. Do you stay Moderna or do you skip over to Pfizer? Or is Johnson & Johnson okay?
So the current standing order for the additional dose is for those who are immunocompromised and have not developed a sufficient antibody response. So that's why they're calling an additional dose. The booster is for those who are completely vaccinated, and it's an additional dose, right? Just like we get boosters for flu every year, although it might be a different strain every year. And so currently, if you receive Pfizer, your first and second dose, you will receive Pfizer in your booster. And the same applies for Moderna. We don't have any authorization or guidance around Johnson & Johnson at this point in time. I did read a recent update that that there may be situations in which an individual had Moderna 2 doses and the physician is ordering that they get a Pfizer. And we actually did recently have a case of this, and it was because of treatments they were receiving. They were so immunocompromised, they had not developed an antibody response, and that provider who was like, felt that or thought, and I of course I didn't speak to them, that the Pfizer would help trigger a more robust antibody response. That's not something we would do. We always work under Oregon Health Authority standing orders, and we don't deviate from that. So if there's any deviation, that would be either off-label use or by physicians.
And I guess my final question is, well, it's a comment and a question. I really appreciated how our public health Clatsop County website has become more like the Taste the Rainbow post was fabulous. Encouraging healthy eating, encouraging exercise, encouraging mental health. I love that. And I'm going to speak from a parent perspective right now as we're going into school and we're going into the cold and flu season. If I were a parent, and I am, or an adult, and I've done all the things, I'm masking, I'm following the rules, I'm vaccinated, et cetera, et cetera, et cetera. Is there a way to broadcast a message that says, here, take, I don't know, milligrams of vitamin C, make sure you take your multivitamin. Here's how to healthfully and naturally boost your immune system as you move into this kind of a scary time for families, I think. There's a lot of unknowns that are at play right now. And, you know, we're tossing our kids out there in the mix here in 2 weeks and, you know, just letting them fly and hoping for the best. And so is there like some sort of messaging or something that we can do for families that say, because I'm very linear and I'm a planner, and I know that there's other moms out there like me who would love to check the vitamin boxes to make sure that they're sending their children out into the wild blue yonder as healthfully as possible.
So I have 2 responses. One is, I'll start with what I know, because I asked a question today on a call about when updated FAQs and information packets going to become available to the communities about flu season, and then flu season in the context of the pandemic, and then navigating. And they've said this in the past, but I think it's, you know, we're a winner, more than a winner away now from you know, navigating flu season. And I think it will be different this year because we've opened up again as a society, so there's more opportunity for the flu virus to transmit as well. And so that flu, COVID, flu prevention for school age families, community, flu and COVID, all of that is going to be released September 13th, I think was the date. As well as I was sent another hyperlink because I think I brought it up in this I've had a lot of meetings today, one of the school meetings. So I think, so that's coming, and we will definitely piggyback on that. And in terms of recommending specific interventions, we won't be recommending that people do vitamin C or they take this supplement or they do this, do that. That's not really our role. Our role is to provide information around what we know are truly preventative measures. But it's that fine line between sort of prescribing over-the-counter interventions, which is not our role and not something that we would do, and also recognizing that just like with COVID, individuals have different ways that they like to manage flu season, right? In the winter, right? Whether it's taking echinacea or it's taking, you know, bolusing and vitamin C or doing, you know, eucalyptus or whatever. So I think that some of that needs to be left up to the individual. So we won't go that far, but we will be making a lot of flu information available very soon. I mean, I'm curious about it because I'm like, so how do I navigate my, I do always get my flu shot and I believe in it. And, but I'll also be eligible for a booster for COVID as well. So I'm a consumer just like everyone else in that realm. So.
Well, I want to say thank you for strapping yourself into this roller coaster with us. I really appreciate your methodology and your feedback that you provide. So keep on keeping on. I don't want to see you go anywhere. Can you stay forever?
Thank you. That's very kind.
Commissioner Thompson.
Thank you. Well, I would amen that, but I think you probably have other plans for your life. So grateful for what you've done. Thank you.
I'm just trying to get through each day right now. I can't even think about
that. And I know. So here we were. We thought, oh yeah, we're kind of at the end of COVID. Oh no, we were in the eye of the hurricane. Here it comes back, stronger, harder. I want to say wilier than we were prepared, than I was prepared for. And so I'm thinking about the mental health aspect, the community's mental health, the community's capacity to be, you know, I want to say serene in a way in the face of these kinds of extreme challenges that are outside the realm of our comprehension or our collective experience. Still navigate empathetically, seeing some people don't want to, whatever, mask or vaccinate or whatever. Some people have a negative response, you know, physically to stuff. How do we work together as a community of sound mental health?
Mm-hmm. Oh, that's a big question. That's a community meeting in and of itself. But I think about this because it's not just the community; it's those of us, honestly, who are literally living and breathing this all the time, right? It's waking us up at night. Like, how do we care for our community in the best possible way? And to be very discerning, and also to that second guessing of, you know, was this really the right strategy, or should we have taken that strategy? And so I think part of it is what we already know how to do, which is the empathy, it is the compassion. It is the listening to one another, right? We don't have to agree to be able to listen to one another, right? And I've said this before, if we're willing to pause for a moment and just reflect, history has a lot to teach us, right? So there's that part of it, right, which just calls us into action, and I think in ways that best represent who we are as a shared humanity. In terms of standing up additional resources for those who require additional supports beyond what we identify at our clinics, right, and all the different outreach activities we have. I'm in fairly frequent contact with Amy Baker. There are definitely stressors. I am deeply concerned about the staff who are working in long-term care facilities right now, deeply concerned about them. And so your point is well taken, of how beyond the most obvious practical steps, how do we continue to support that in ways that facilitate resilience and acknowledge and recognize not the perceived horrors of what are happening, but actually what the extraordinary work that's happening, because people are still showing up every day. And so thank you for that. And while I think about it, just having that said out loud, I'll be pondering that. And it's certainly not mine alone, but it's like, what more can we do as a community? So thank you for that. Right? We thought we were in a better place, right? And
So
we're actually, yeah.
implicit in that is our incredible gratitude to you and the other staff. If you or the other staff can help us provide you with more appreciation, with more support, emotional, practical, whatever it takes, please let us know how we can support your good work. We are so grateful to you.
Thank you. Thank you. Well, I didn't share this before, but I know Commissioner Cuevas brought it up earlier in a meeting that we were on together today, is that just the way we're all working together, right? We had to figure this out, right, a year and a half ago, and now it's just a given that there is no alternative, there's no choice. And I want to recognize the interim CEO at Providence Seaside Hospital. She's convened a standing meeting now between Eric Thorson and myself, so we'll be having just the three of us get together every Friday just to touch base. And we're working on it, and actually I think that will be, I think I'll bring your question to that meeting, Commissioner Thompson, so thank you.
Thank you, Commissioner Thompson. I see Commissioner Webb has her hand up. Commissioner Webb.
Yeah, I wonder the extent to which you have enough financial resources. Maybe, I don't know, Don, if this is something you might want to address, but would more money help?
Oh, well, I actually, my cheeks hurt a little bit from smiling, because I am telling you, I've been in public health a long time, and I've never seen this many resources in public health, right? Which is, it's bittersweet, right? It's tragic that it took something like this, just like it took 9/11 to wake up to the importance of a strong public health infrastructure. But we do have resources, right? We do have resources, so that's not the challenge. What the challenge is what we're all facing, which is workforce, right? And then also it's very different training, hiring a nurse fresh out of nursing school, and there's a shortage of them right now, right? Who has been trained to work at the bedside, and with the proper, kind of support of a seasoned nurse, they just do what they were doing in clinicals. Public health practice is it's complex. It's a different level of thinking, a different level of analytics, and it's very much systems work. And so as we are hiring and we are continuing to recruit, in fact, we've made 7 hires, I think 6 or 7 hires since I've been here, and we're recruiting for a couple more positions. And part of it is while we're responding to COVID, we are building up the public health infrastructure to sustain our work going forward. These are permanent positions for public health. So I thank all of you for supporting that in the budget going forward, and the advocacy from county leadership. So thank you for the question. It's so appreciated, and the support is there from all of you, and the resources are there. And it's just I'm not someone, we react when we have to, but I don't like to be reactive and go, oh my gosh, it's about hiring more people and let's get them on board, because hiring people is very labor intensive and it takes time. It's what are our priorities? What are the assets that we have? How do we leverage them? How do we work together? For example, CMH is providing some staff for our testing sites, right? So it's not just dependent on volunteers who we're now going to need for vaccination. So I'm trying to be just thoughtful about that. But thank you so much for the question.
Thank you.
Any other questions? Thank you again, Director Lalich, for all you're doing. I know you're back-to-back meetings all day long, and I really appreciate the efforts to mobilize that testing site out at Camp Riley and vaccination site. That's a huge development and will be an asset. And certainly, I do appreciate on behalf of the hospital your coordination with the healthcare industry and getting everybody on board and meeting regularly. It's very needed and it's very appreciated. So thank you.
Thank you so much. Great.
We'll move on to the next item on our agenda, which is the National Community Survey. It's on page 4. And I will turn it over to Don.
Chair Quaylen, members of the board, I'm going to go ahead and make this presentation, and Teresa and Amanda are here to answer any questions that I may not be able to answer adequately. When I first came on and we started talking about strategic planning, one of the suggestions that was made by more than one board member, and we've also heard it from some community members, was to engage the public in an annual survey to understand the issues, the concerns, as well as the positive attributes that might be taking place in the community. And so at a staff level, we started looking to see what the options were, because we didn't want to recreate the wheel. As we all know, surveys are a very scientific-based activity, and to make sure that they're valid, there's a lot of math and a lot of science behind them. And so we were looking for something that would be valid, statistically meaningful, but that would also show the trends over time, allow us to compare ourselves to other like jurisdictions, and then finally, hopefully create a database of respondents that we can also reach out to for other questions or other surveys. And that's something that Washington County did also, was to create a database of folks that they can just go to routinely and just feel out what their concerns are and what their feelings are. So that's kind of where we started, and where we had landed is on the National Community Survey, which is a partnership between ICMA and the survey, and it's a standardized community assessment tool for local governments, and it's being used throughout the United States. Within the Northwest, some of the jurisdictions that are also using it include Albany, Wilsonville, Corvallis, Tualatin, Spokane, Pasco, Issaquah, Woodinville. There's not as many counties from the Northwest, but there are counties from other parts of the country. And my view at this point is it's not bad to be the first county from the Northwest. So. But we provided a sample of the survey. It touches on a number of different factors, and I won't read through all of them. But what I will say is that there's always kind of a calibration when a county does surveys, because we're also surveying county residents that happen to be residents of cities that are also receiving services from special districts. And so as we ask questions about how's Clatsop County doing, we're also getting answers about how their neighborhood's doing, or how their city's doing, or how they're receiving services from their special districts. So as we've gone through this survey, and we think a lot of the questions are very apt, there are certain adjustments that we would make to the survey, just so that it doesn't go too far out of the county lane. But we would ask folks, where they are from, and that could be as easy as saying, are you from incorporated city or an unincorporated area, or it could be, if you're from an incorporated city, which one, so that we can look at that data and break it down in some meaningful ways. I think the cities would have some concerns if we're doing a survey of their residents and asking city-oriented questions, if there's not a large enough sample size to kind of validate their own city's results. And so, so there's a balancing act there that we'll continually discuss, but we just wanted to really present this survey as kind of an option, as kind of an overview. Staff thinks that if we could do it every year, or minimally every 2 years, that it could start providing data that could really be useful to the strategic planning processes, could be useful for the budget process, and it'll give us a way to engage citizens in a manner that we don't do right now. So that's kind of what our thoughts are. We're happy to answer any questions. On the cost-effective side, it will be about $17,000 for every time we do the survey, which I can say, having done many surveys during my career, is a heck of a deal. And so, so that just gives you a little sense that we benefit from the fact that this is already a survey that's been, time tested, it's been used, validated. So we get to benefit from some of that previous work. So again, we're just presenting it as an option. If the board is interested in this, staff will do a little bit more work to go through some of the questions, and then we'll share it with the board one more time before we would then have the national community survey folks push it out into the community. So I'm happy to answer any questions. Teresa, Amanda can answer them as well.
Commissioner Thompson has a question.
Thank you. I'm so happy we're doing this, because I'm assuming that we're doing this. Well, just saying, those sports movies where the team moves up from like AAA to AA, or even up to the big leagues? I feel like this will take us up to the big leagues. So that's my personal hooray, let's do it. Second part is, when I was involved with City of Portland activities, their hypothesis was doing a sample size of 500 was adequate to achieve reliable results. Do you agree with that? Or do we have a number of sample size that we're going after?
So I think what has been recommended, the sample would be 1,500 mailers going out, and then we would also be having an online presence also. So 1,500 is kind of the random sampling size that they recommend. So.
Assuming a return that will generate a sample size of 500. I mean, I assume that that's kind of a valid thing.
Yeah.
Great, all for it.
Again, Commissioner, part of the benefit of using them is that they provide all that support to us, and they have all of the formulas for how many to send out, to receive so many back. It takes out a lot of the uncertainty. And as I think you all know, staff are not expert poll takers or survey writers. And so I feel much more comfortable writing on the experience of the National Community Survey than I would us going and creating something unique.
Agreed.
Thank you, Commissioner Thompson. Commissioner Webb.
Yeah, hallelujah. Commissioner Thompson and I have been pushing for this for several years, so I'm pretty excited about it. When I was talking to the county manager the other day, I asked if our 5 cities were doing any surveying. Did you check that out, county manager?
I did, and I can defer to staff for the more detailed answer, but the short answer is that there hasn't been the kind of overarching surveys, at least that I've seen, and if Amanda or Teresa wants to correct me, you can. But from what I've seen, there hasn't been kind of an overarching communities survey. But certain cities have conducted surveys for their police activities, for basically public safety surveys, and then there have been other specific surveys for certain service areas, but not what I would say is a survey of a community that goes from the economy to arts and culture to all those other elements.
Okay. Have we spoken with them about whether they would be interested in a robust participation in this? Do we know that?
We haven't yet. That's something that if the board is interested in moving forward, we would share this with the cities and see what their feelings are about that. And then we'd also have to also talk to the national survey folks just to see if we were trying to get valid responses for all the cities, what would that mean? Because that would mean something different than just trying to get valid responses just for the county. So it gets into a level of complexity, and I am just guessing, but I think some of the cities may not be ready for it because surveys have to be fitted in to their program and to their priorities. And so we will talk with them and figure out what the right path forward is.
Yeah. I have been involved in both city surveys and also in county surveys, and I found I was lucky enough to be working in Portland when they constructed and ran their survey for a number of years, and it was very, very robust. It was a terrific survey, and we learned a lot. In the county survey, I think is much more challenging because for several reasons, really. Citizens don't necessarily know who provides their different services. And so when you ask for an opinion, do you feel safe in your neighborhood, or, that's going to be, those answers are going to be quite different. My other learning from a county survey is that you have to widen the number there. Commissioner Thompson and I argue over the survey numbers constantly. We've had this conversation before. But my experience with a county survey is that if you want to make it meaningful for city data, you have to broaden the scope, because you have to then have a representative sample size from each city. So, the statisticians will always say that number is 400. Commissioner Thompson thinks it's 500. Anyway, that's why you pay these guys to do this. So we might, I would love to actually have the cities participate, something robust that you're talking to both cities and your county. But at the same time, if you do a survey that is for a county, it is absolutely integral to know where those results are coming from, because counties are tremendously diverse places, and so it does It does, not only does it impact the number of surveys that you launch, it also impacts the distribution that you're targeting. So it's a little complicated, but and I love the idea of a survey that we could benchmark across other counties. It sounds like in the Northwest that wouldn't always be possible, but at least it's moving toward that. And the urban-rural issues in a survey are just tremendously important to be able to distinguish them, you know, the responses by urban and rural. So that's but thank you. This was great work, guys.
Thank you, Commissioner Webb. Any other questions, comments? Sounds like we have a great deal of support for the survey. And
Great,
the
thank you.
sample size I saw is 385, but I just Googled it. So we'll move on to boundary redistricting 2020 decennial census data. It's on page 12. And I'll turn it back over to our county manager.
Chair Quayla, members of the board. With the completion of the census, that triggers a number of activities for the county, but not just the county, for the federal government and state governments as well. But for us, we look to the charter for our guidance about how we're going to approach the redistricting process. And so basically what the charter provides is that once the census data is released, that we have 120 days for a recommendation to come from the county clerk, who is the elections officer, to the board about a recommendation for boundary changes, with the goal of having each district be roughly equal in population. And then 45 days after that, we have to approve those boundary changes. And so, meaning the board would have to actually approve them. I've been through these processes before. And so what I have found is that a great way of doing this is to have a third party come in and support the process of analyzing the data, working with the criteria that is in statute and any criteria that the board has to really guide the process, and have them come up with alternatives, because there isn't one district map that is really obvious. There'll be a number of different versions that will be presented to the board based upon those criteria. And once the board reviews them, asks questions, then you go into a public input process where you allow residents to review those, ask questions, and give any opinion about which version that they think is the strongest version. In my experience, there is usually one or two that rise to the top, and those are the ones that then the board ultimately chooses from. This year has been a little different because the census took a little bit longer to come out. We have some other pressures because we have an election in May. And so part of what we're also trying to do is to accelerate this so that we can get the districts done before the May election. And there's a time frame that you have to basically start earlier to actually reach that actual date that we need to be done. And so based upon in the agenda materials, we said that the Census Bureau was estimating a release date of September 30th. Well, the release date was actually August 12th. And so we're already in our 120-day period. The good news is we've already started working on it. But what that means is that the end of the 120 days would be December 10th of 21. And then the 45 days would get us to January 24th of 2022. So that would be the final date of approval. We're trying to actually get this done sooner than that. So we've asked Center for Public Service from PSU to partner with us. And if that's familiar, it's because CPS was who was helping us with the strategic plan. It's a different team, but it's from CPS. And then they're also going to be using PSU's National Policy Consensus Center to help with the citizen outreach piece to this process. And so they'll be helping us with the data, coming up with, I mean, what the first step is to come up with where are we? So in 2020, what's the population of the 5 districts? So that we know the size of the discrepancies between each district. And then we will discuss what those criteria are. They'll go back and start working on the different alternatives, versions. And then we'll start the process with public outreach, discussions with the board. So that's what we are recommending. I think in my experience, it's been a very fruitful process. The public has appreciated it. As we all know, redistricting can be political, and we're trying to remove that aspect of it. But what we do know is there will be changes to the district boundaries. You know, we have grown, and I'm sure that the growth has not been proportional in every district. So we do assume that there'll be boundary changes. So we just wanted to present this. It's a big project. It's an important one. I think we have a good team to support it. Tracy's here. She's at the clerk's conference, I believe, or clerk's meeting, or has been. And so she's been getting updated information from the state also. So we just want to present it, let you know what is happening. We'll be asking your board at various points to participate, to give input leading to your actual adoption. So, and that's the end of my staff report.
Yeah, thank you, Don. Any questions about process timeline? I see Commissioner Toyoka.
Yes, question and input actually here. In the redistricting, you know, I was just up in a residential neighborhood yesterday talking to some people, and it's, you know, as we're looking at this redistrict process, we have one house on one side of the road is District 2, their neighbor on the other side of the street is District 5. And so not being politically, but just, you know, neighborhood wise, in the redistricting, we keep neighborhoods intact because they all feel like there are certain issues that, you know, work with their neighborhood, their community, and then they're being split by district. You know, and I said, well, you know, even though Commissioner Thompson is District 5 and I'm District 2, we're both working for, you know, for your behalf of Clatsop County, so you don't have to worry about that aspect. But I think, you know, people would rather be in the same districting as their neighbor across the street. And I know in between 2 and 5, there's a big, you know, cutout in the middle. So many neighborhoods are split. So during the process, if we could, you know, unify those neighborhoods, make the lines differently, I don't believe it's a political. I think it's more of a neighborhood, you know, keeping neighborhoods together in the district.
Commissioner Toyoka, that's a very good point, and that's one of the criteria that we used in previous redistricting that I was involved with was to consider community integrity, and that could be neighborhoods, it could be, you know, larger areas. Over in Washington County, you know, every district had about 175,000 residents in it. So there was a lot of flexibility on where those lines are drawn. But one of the things that I experienced that as we had growth, community integrity changed because some of these neighborhoods were new and sometimes they were split and sometimes they evolved and they matured and they wanted to be together. So I think that's a really good point, and that can be one of the criteria that your board can adopt and that can be considered as we move forward.
Commissioner Thompson, then Commissioner Bangs. Commissioner Thompson.
I would just speak in support of Commissioner Toyoka's comments. he's right. We have extremely, I want to say idiosyncratic district lines. It's confusing to the neighbors. It has also been in the past confusing to the county staff for the integrity of the election process. So once we get it decided, let's make sure those ballots match up. It makes life easier for everybody.
Thank you, Commissioner Thompson. Commissioner Banks.
I concur. I really truly believe we need to keep communities of commonality together, be it a shared water district or a shared sewer district or just a shared school district. But keeping communities of commonality together and it could be across the board, via neighborhood or so on and so forth. So I concur. Thank you, Commissioner Toyoka, for bringing that up.
Anything else? And so with the accelerated timeline, this draft timeline we have, is it remaining the same pretty much, or is it changing in any way?
It will change, and we will update this, and we will put it in your Friday update, just so you have a sense of how this is going to be altered based on the release date. But fundamentally, we'll be adopting, hopefully in this calendar year, is really the goal, is to adopt the redistrict boundaries. So, and I'm throwing that out as a general statement, but we will give you the more hard dates after we have time to actually absorb and work with our partners to come up with an updated calendar.
Okay, thank you, County Manager. I see Commissioner Webb has a question.
Yes, I just have one question if Tracy is still on the call. Have we figured out, going back from the spring primary, have we figured backwards to the magic date that is the last day to register for office? Did I ask that question confusingly? You look confused. I'm sorry.
I am very confused. I'm not sure what you mean, Commissioner Webb.
Okay. Well, there's always a date prior to the election, which basically kicks off the campaign season. And it's the last day that candidates can register is probably the wrong word, can submit their
File.
Filing.
Thank you.
I do not have that date in front of me.
Okay, that's fine.
The first day to file is September 9th. We will take filings through, the filing deadline is in March.
Yeah.
And at that time, people can withdraw and refile if needed.
Right. Okay, that's fine. It's not important.
Okay, thank you.
If I could real quick, Chair Cuellar, is that I think that's how this process is going to interface with the clerk's election calendar, is that obviously somebody could file early and then the district boundaries change after they filed, and then they may have to, that may impact their filing later. So that's a legitimate potentiality as we walk through this. So.
Are we bound by state law to that September 9th date? What who decides?
Well, ORS statute determines our election dates and first days to file because it is a primary. They have to have a set beginning date for candidates to actually file. I know they can have campaigns already going and open, but they can't actually file for the positions until then. The state is having the same issue, so they're in just as much of a concern as we are at a local level, at the state level, for boundary changes.
Okay, thanks.
You're welcome.
Thank you. Good discussions, good questions. We're right up against it. Does anybody need a minute, or are we ready to just go right into the regular session? Are we good? Okay, so we'll go ahead and begin our regular session, our regular meeting. The Board of Commissioners, as the governing body of Clatsop County, all county service districts for which this body so acts, is now meeting in regular session. Teresa, can we take the roll call?
Yes, Chair Quila,
Here.
Vice Chair Thompson,
Here.
Commissioner Toyoka,
I am here.
Commissioner Webb,
Here?
Commissioner Banks,
Here.
Okay, all present and accounted for. We'll go ahead with the agenda approval. Is there a motion to approve the agenda?
Mr. Chair, Commissioner Thompson would move to approve the agenda.
I will second.
Okay, moved and seconded to approve the agenda. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. Next. If I can find my spot here, did we go right into our business from the public?
Yes, sir.
So business from the public, this is an opportunity for anyone to give a 2-minute presentation about any item on the agenda, except for public hearings, or any topic of county concern that is not on the agenda. Clerk of the board, are there any members of the public who have registered to speak?
yes.
Okay, if you have registered to speak, please wait until your name's called, then give your name and address for the record, and you'll have 2 minutes. Okay, Teresa.
Maria Stark,
Hi, thank you so much for calling on me. Can you hear me?
We can hear you.
Great, fantastic. My address is actually 50 Downs Lake Circle in Dallas, Texas, but I work regularly in Clatsop County and have done so for the past 6 years. And so I just had a question about a process that a group of us engaged in for getting feedback from the county residents about spending priorities for the county. And so the group called CHART and Wellville, which I represent, offered our expertise to the county to conduct community assessments. And I know that a member of the county commission, I think Pam Webb, had suggested that there be outreach to residents. In any case, within a short time window, we partnered with Consejo Hispano to get feedback from the Latinx community, and we had 51 participants that participated in, allocating, just a notional amount of money to sort of get a sense of what were the top priorities. And the top priorities for these 51 residents of Clatsop County were childcare and good paying jobs. And I sent around a infographic with that information, and the mayor of Astoria, Mayor Jones, said that these really reflected the exact same priorities that the rest of Astoria residents had told him for the past few years. In any case, we were curious about a response and from the county and county commissioners, what they thought of this resident input, and if and how it will influence their budget priorities. And then secondly, just we're curious if the county would like us to assist them in ongoing data assessment. Thank you.
Thank you very much. And we've had a number of discussions about the, and I'm assuming this is talking about Rescue Act funding.
Yes.
And child care has been something that we have been focused on. When is that coming back to us, Dawn?
Chair Quaylen, members of the board, that'll be coming back on September 8th. We'll be having a conversation, and all of the input that we have received, which has been substantial, has been informing what the next iteration of the draft concept plan is. So that'll be in your materials for the September 8th meeting.
Okay, thank you, Don, and thank you, Ms. Stark. Teresa, do we have anyone else that has registered to speak?
No, that's everyone.
Okay. Well, we'll go ahead and move on from business from the public and into the consent calendar. Has everyone had an opportunity to review the consent calendar? Any questions, comments about the consent calendar?
Mr. Chair, Commissioner Thompson would move to adopt the consent calendar as presented.
I will second.
It's been moved and seconded to adopt the consent calendar as presented. All those in favor signify with an aye.
Aye.
All those opposed? Okay, motion carries. We'll move on to the commissioner liaison reports. I'll start with Commissioner Thompson.
Thank you. Well, so interesting to think about childcare because Commissioner Bangs and I were on a call this morning at 9 a.m. with Congresswoman Bonamici's staffer, Ali Mayeda, known and beloved by many here. We asked the staffer for a list of resources that we could use as a county specifically to support providers of childcare and parents. And Commissioner Bangs, I'll defer to her for more.
Oh, Commissioner Thompson, I think you froze again. We'll go ahead and give you another opportunity when you come back to us, but let's go ahead and move on to Commissioner Banks.
Yeah, just to follow up, we enjoyed early morning meeting, and it was nice to be able to share our local cares and concerns in regards to childcare, but then also have the request of what can you do for us, basically. And it's good to have that open communication. And fortunately, she also has Eva Menderson on that she meets with regularly. And so it's nice to see a very cohesive movement between the group here that we're developing and then also at the federal level. And then just to follow up with my other liaison reports, the fall tour will not be occurring here this year for our leaders in our community just due to the COVID restraints and the cares and concerns regarding our current pandemic situation. But the fall tour is going to, and for those of you who have never attended the fall tour, it's private landowners in our area. It's an educational tour in regards to our natural resources forestry industry. And so instead of the fall tour, they're planning a spring tour 2.0, I guess, and they have some amazing ideas, hopefully involving some of our youth also in the process and really pushing a job and leadership aspect. And I really appreciate the thoughtfulness that's going to be going into this entire process. So I look forward to the tour myself, and then hopefully you all will be able to join me in that endeavor. So thanks.
Thank you, Commissioner Banks. Commissioner Thompson, you froze while you were presenting your report. If you want to go back and continue, I think you were still speaking to the phone call this morning.
Thank you. So we had a good call. We'll have good follow-up. We hope that means money for parents and for providers. The second thing is the State Emergency Response Commission met, and we had a presentation about the cleanup after a wildfire. And I don't know about you, but I hadn't thought about what was contained in that. So it's not only construction and debris, it's not only metal, there is also hazardous material in the waste and ash, and what it takes for people to be able to come back and rebuild their communities. So we're continuing to focus on prevention and resilience. We've got this firefighting I want to call it a task force that the county manager has helped us develop, but we're looking at preventing fires through education, but we also need to think about how do we recover afterward? What does it take to clean up in order to rebuild? And then the third thing is I've been talking with the folks about the coast trail, about people who want to hike and be responsible tourists. And so that's just another area of interest I have. Housing is the main area, continuing to talk to other commissioners and to look at how COLPAC can be a leading organization for a coordinated activity with us, our commissions up and down the coast, AOC, LOC, the Coastal Caucus, all of those, trying to get all those moving pieces integrated into a functional whole that actually delivers housing. So long-term complex efforts. Thank you, Mr. Chair.
Thank you, Commissioner Thompson. Commissioner Toyoka.
Well, good evening, everyone. I just want to report I had a visit and personal meeting with the executive director of our Association of Oregon Counties. Her name is Gina Nickel. Great visit, a lot of topics covered, but the overriding principle is that, the voices of rural Oregon need to be heard. We're outnumbered by our urban counterparts, physically, but in terms of natural resources, in terms of, square mileage, rural Oregon is the majority of the state. So we need our voices heard and our concerns heard. And I see that, through organizations such as AOC and the banding together of counties, if we work together with, coastal counties such as Tillamook, we are much more effective in communicating our message than as we stand alone as Clatsop County alone. So I think the message we take away is that, yes, there are avenues for all of the voices of Clatsop County to be heard, and banding together with counties, other coastal counties such as Tillamook will strengthen our argument and help us in these endeavors. So I think we've made great inroads, and I think there's another, as commissioners, the five of us and the staff, I believe we are very united in the cause. And we take that same principle with other counties. I think we can push some good agendas forward to support the people of this county. So I look forward to continue that pursuit. Thank you.
Thank you. Yes, thank you, Commissioner Toyoka. Commissioner Webb.
Yeah. First of all, let me report that the Arts Council has now submitted an application to become a nonprofit organization. That won't necessarily sever them from the county in terms of our financial support and interest and cheerleading, but it will allow them to seek funding from other sources, which is a really terrific idea. In terms of workforce, the Northwest Oregon Workforce Council, which is a 5-county group, something kind of interesting has happened with all the government pandemic funding. I think I've mentioned before that in workforce development, usually the funding from Congress is in direct relationship to unemployment rates. And it has been very interesting during the pandemic that is not the case. And so, and in our region, some of the service issues have gone from getting unemployed people trained and employed to helping businesses get staff. So it's been an interesting, in my years of work with workforce, I've never seen this happen before. So it's kind of it's very cool. But the funding is stable. We were worried that it wasn't going to be, but it has been, and we have gotten pandemic dollars. Unfortunately, we thought that all of our work systems facilities in this area, which, as I say, it's Columbia, Clatsop, Tillamook, Lincoln, and Benton. Our funding is robust. We thought we were going to be able to open all the work source centers completely in September, and it looks now like we're not going to be able to. So it's, it's providing a disconnect between those who want work and those who don't. So it's kind of an anomaly. It's another one of those interesting things that has happened during the pandemic. Our tourism group is very interested and is really working forward with messaging about how to behave when a visitor comes to the coast. And so we've actually got a grant that we're studying what would be the most effective resources for ideas, everything from, a video that goes on YouTube to mandatory display of how to act in vacation rentals and in hotels, etc. One of the interesting things that has happened, we should write a book about 100 things that changed in the world during this pandemic. But another one is that the increase of people who want to camp at the coast has risen astronomically. And it has happened both in, of course, our parks, but it's also happening in our forests, which is becoming apparently a little bit of a headache for some of our larger forestry folks. So at its end, ODF now has a newly funded initiative to implement. It's called REI, Recreation and I don't know. So anyway, they're going to have a specific focus on resources available in state forests for tourists. So, we're actually stimulating the demand, and yet we have people causing parking issues on forest roads, not registering. All of our forest companies in Clatsop have wonderful log on with your iPhone if you want to come in our forest. People apparently are not doing that. So anyway, this is something that we're going to have kind of a special meeting. We were going to have a big meeting in September, but anyway, lots of activities. We were kind of unsuccessful in recruiting volunteers to be ambassadors on trails. We think that people are afraid of COVID, and unfortunately, we've had more folks on our trails than ever before. So we're a little disappointed in that. I would love to hear from Crest and Colpack what's going on. Could we have like a presentation or something from those guys? I know.
I think we
Just
got
an
one.
idea.
I think we got one lined up for Crest, Teresa, right?
Yeah, I did want to interrupt and say we do have Crest scheduled for September 15th.
Oh, yay. Okay. Thank you. That's it.
Yeah, thank you, Commissioner Webb. And I agree with your comments about Department of Forestry. I think that we need to work closely with them and follow up from our work session that we had a couple months ago with some of the headaches that they're having to deal with out in the woods. Commissioner Thompson has a question or comment.
I did do a follow-up. I did speak with Commissioner Highmiller, and this relates to Commissioner Webb's comment about Colpack and Northwest Act, because Northwest Act has a few minutes before the Oregon Transportation Commission in October, and dealing with those forestry issues is something that I've asked Commissioner Heimiller to present to the OTC. I spoke briefly with Police Chief Jeff Spalding from Astoria about that. I'm continuing on that, so I just wanted to jump in with that. Thank you, Mr. Chair.
Appreciate your efforts in that, and thank you, Commissioner Thompson and Commissioner Webb, for bringing that up. I just wanted to really quickly say, this has been an 18 months like no other, and I think we heard from our public health director about the challenges over the last month. We are going to have a Caregiver Appreciation Day at the hospital tomorrow, so August 26th is going to be Caregiver Appreciation Day, and we're going to try to recognize the hard work over the pandemic from so many people here at the hospital. It's going to be capped off with a proclamation from the city of Astoria declaring Thursday, August 26, 2021 as Caregiver Appreciation Day. They obviously didn't want anything from the chair of the county commission. It was much more meaningful and impactful to have something from the city of Astoria. But it is going to be a good day and an opportunity. It's all virtual, so we're going to be doing all of our activities virtually, but an opportunity to kind of show some to honor and kind of show some appreciation for all of the hard work over this period of time. We'll go ahead and move on to the county manager's reports. And County Manager Boone.
Great, Chair Quaylen, members of the board. I mean, honestly, from my seat, it's hard to believe, and I almost can't wrap my head around when we say 18 months, because I don't think it's been 18 months. It's been at least 3 years. I mean, I don't know. We have to double it because that's what it feels like. But even during the pandemic and all the amazing work of our public health staff and really all of our departments who in their own way have been doing amazing work. We have still been working on some of the more visionary activities that the board has been pushing us on, and one of those that came from the board, and I remember sitting in meetings with Commissioner Thompson, Representative Mitchell, and others a year or more ago, it seems now, I'm not really sure, about the Jewel broadband issues. And so we've been working on this project for the last year, and we have come to the point where Steve Phillips from the Jewel School District will be at your September 8th board meeting to present a project that will foundationally improve internet availability and internet performance in the geography of the Jewel School District, which is a large area out in western or eastern and southern Clatsop County. So Steve will be here September 8th. So we'll be talking about the ARPA concept funding plan, and as part of that was a set aside for some infrastructure, and one of those infrastructure initiatives was for broadband improvement in the rural areas. And so I just wanted to, say that we've made progress, and progress will be discussed at September 8th. So that's all I have. Thank you.
That's fantastic news. I know Commissioner Thompson is extremely excited to hear that. If we don't have any other reports, I'll go on ahead and move on to the public hearing this evening. We have a short-term rental moratorium ordinance 21-03, second public hearing on page 112. And if everybody's there, we'll go ahead and hear the staff report. And is that going to be, who's going to be presenting the staff report?
I believe Julius on the line.
It's I think Joanna was going to provide the staff report, but
Oh, okay. I apologize.
So Joanna?
Thank you. Good evening, Chair and Commissioners. Are you all able to hear me?
We are. Yes.
Okay, perfect. Thank you. I apologize. I'm at the county council's conference, and so my internet is not the normal internet as it is at in the office or at home. So my apologies. So in front of you tonight is the second public hearing of Ordinance 21-03, implementing suspension of a new short-term rental licensing processing. At your June 1st, 2021 work session, your board directed staff to draft a short-term rental moratorium ordinance. Staff subsequently conducted 2 virtual town hall meetings on July 9th and July 16th. Staff accepted those written comments and provided those comments as well as the transcripts from the in-person comments at the town hall meetings, and provided that to your board at the work session held August 3rd, 2021. On August 11th, 2021, you conducted your first public hearing of Ordinance 2103, and tonight is the second public hearing and second reading of the proposed ordinance. The county has provided the required 45 days notice to DLCD. We filed that with DLCD, Department of Land Conservation and Development, on June 4th, 2021. Per ORS 197-520 subsection 4, an initial moratorium may be in effect for up to 120 days. And it can be extended for an additional period of time, provided that we give DLCD notice at least 14 days in advance. And that is really because some of the lands within the area that are subject to the ordinance are considered urban or urbanizable. And that would include the urban growth boundary of Gerhardt. So the moratorium would not apply to any short-term rentals within the boundaries of an incorporated city or within the UGB areas of Astoria, Warrenton, Seaside, and Cannon Beach. During the moratorium, the following would occur. No new short-term rental applications would be accepted, processed, or issued. There would be exceptions granted for applications that have been submitted as of the date and time that the moratorium ordinance is adopted by the board, so those that are pending. Exceptions would also be allowed to transfer existing approved short-term rental permits. If your board approves it, the moratorium would go into effect on September 1st and would terminate on December 29th, 2021. And of course, as we just discussed, that can be extended with 14 days advance notice. Staff has provided you a proposed work schedule, and the work is scheduled to be completed on or before February 23rd, 2022. And with that, we ask the board to hold a public hearing and to adopt Ordinance 2103. I'm happy to answer any questions.
Thank you, County Council, for the staff report. At this time, I think we'll go ahead and open the public hearing. Clerk of the board, are any members of the public registered to speak?
No, there are not.
Okay. If we don't have any public comment, is there anyone else who would like to speak? Anybody that might be on the line that want to speak to this? We'll go ahead and close the public hearing then. And any questions from members of the commission? So if there's no discussion, we'll need a motion.
Mr. Chair, Commissioner Thompson moves that the board adopt ordinance 21-03, short-term rental moratorium, and conduct the second reading of the ordinance by title only.
Second that.
It's been moved and seconded that the board adopt ordinance 21-03, short-term rental moratorium, and conduct the second reading by title only. All those in favor signify with an aye.
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 All those opposed? Okay, motion carries. County Council, can we have the second reading by short title only?
An ordinance implementing suspension of new short-term rental license processing under Clatsop County Code, sections 5.12.010 to 5.12.120.
Thank you, Joanna. With the public hearing closed, we'll move on to the business agenda. And first item on the business agenda is the appeal of hearings officer decision, Smith CUP. It's on page 122 of the agenda. And Julia, are you going to present on this?
Good evening, Chair Quila. Yes, Julia Decker, Planning Manager, Community Development, and I will present in the absence of Community Development Director Gail Henriksen. And I will try and be very brief. I know your board has already reviewed the hearings officer's August 3rd decision and the staff report by Director Henriksen. Basically, this past winter, Community Development received 3 conditional use applications to extend developed, platted public roads, all in the same general neighborhood in Arch Cape, and all the applicants were property owners seeking to access their own properties, but none had immediate plans to develop single-family dwellings. One of the properties, the Smith property, which is the subject of this appeal, includes some wetlands, and the right-of-way next to it also includes some wetlands. According to the local wetland inventory, which is about 10 years old. The Smiths had obtained a wetland delineation that has been accepted by the Oregon Department of State Lands, which regulates wetlands in Oregon, and that DSL approved delineation was part of their conditional use packet application. So public notices were issued, staff reports were written and issued, and staff, because they all came in pretty much at the same time, staff kept the 3 applications tracked together to facilitate record keeping in case of appeals. And in addition to review by County Counsel Joanna Lyons-Antley, staff also called on the additional attorney who specializes in land use matters for the county, Chris Crean, Berry, Elsner, and Hammond. So the staff work and the findings were all vetted by the attorneys, and all 3 applications, all 3 decisions were appealed to the Clatsop County Hearings Officer. So the applications were approved. It was a director's decision, a type 2 decision, and all 3 were approved with conditions of approval, and all 3 applications were appealed to the hearings officer. So the hearings officer heard all 3 appeals on the same day. We had a series of de novo hearings on June 22nd, and that's kind of a lot of hearings. The hearings officer issued the decisions a few days apart, about 5 weeks later, and the hearings officer denied all 3 appeals, upholding the director's decisions in all 3 cases. The specific date for the Smith decision was August 3rd, 2021. So the appellants have chosen to appeal one of the 3 decisions. They selected one, and that is the Smith conditional use permit. Due to the amount of time it took to handle these applications and get the appeals through the hearings officer's decision, the 150-day statutory deadline, plus the extension to 215 days granted by the Smiths, is up in a week. So the county must complete its decision process through and including the local appeals by September 1st, next week. The appellant's grounds for appeal are essentially the same as the grounds on which they appealed the director's decision to the hearings officer. That allowing private landowners to construct roads when no specific development project is proposed conflicts with the comprehensive plan and zoning code, that the wetland delineation approved by the state is insufficient, that the landowners failed to demonstrate that they need access to their property, that environmental and public health and safety impacts of the proposed construction and use of the forested right-of-way for vehicular access were not adequately considered and addressed in the decision, and that the county has failed to have a local wetlands protection program in violation of statewide Goal 5. The report, the director's decision, and the hearings officer's decision provide a clear record, and per section 2.2210 of the Land and Water Development and Use Code, the Board of Commissioners can issue or shall issue an order stating the scope of review of the appeal to be limited to one of the following. 1, you can deny review. 2, you can restrict review to the record made by the hearing body. 3, you could limit review to such issues as the board determines necessary for proper resolution to the matter. Or 4, you could call for a de novo hearing on the merits. Staff is recommending the first option, that the board summarily affirm the August 3rd, 2021 decision of the Clatsop County Hearings Officer and deny the appeal request. And I am happy to answer questions.
Thank you, Juliet. Any questions for our planning manager? Okay. No questions. What's the pleasure of the board?
Mr. Chair, if I may.
Yes, Commissioner Thompson.
Thank you, sir. The Arch Cape Falcon Cove Beach Community Club is one of the parties involved in this matter. For the record, I wish to state that my husband is a member of that board and recused himself for the vote in this matter because of our relationship. So there, for purposes of transparency, I want everybody to know that my sweet husband did not act in any way on this matter.
Thank you, Commissioner Thompson. Appreciate you stating that for the record. Do we have a motion?
Mr. Chair, Commissioner Thompson would move to recommend that the Board of Commissioners summarily affirm the August 3, 2021 decision of the Clatsop County Hearings Officer and deny the appeal request.
I will
Commissioner
second
Webb
that.
seconds that.
Been moved and seconded to recommend the Board of Commissioners summarily affirm the August 3rd, 2021 decision of the Clatsop County Hearings Officer and deny the appeal request. All those in favor signify with an aye.
Aye.
Aye. All those opposed? Okay, motion carries unanimous. Thank you, Julia.
Thank you, commissioners. Thank you, Commissioner Quila.
We have no other items on the business agenda. Let's go ahead and move on to good of the order. Does anyone have anything for the good of the order this evening? Seeing none, we'll go ahead to the executive session. The Clatsop County Board of Commissioners will now meet in executive session